Well, at the beginning, it just started with headache and body started to ache. And then the temperature comes and start to cough and breathing issues and all that all comes.
Ben Ong has been working from home, rarely leaving the house for months. So when he began to feel unwell 2 weeks ago, he thought it was just a cold, until he, his wife and their 3 children all tested positive to COVID.
At the end of the first week, I started to have more symptoms. I started to cough out some blood clot. So I was a bit concerned about that. So I called a GP, and the GP told me that there's nothing they can do. They don't have the equipment, and I'll have to go to the hospital.
Ben and his wife believe they contracted the virus from their children, who spent time with a relative who worked at JBS Meats and later tested positive. So far, their children have only suffered minor symptoms.
That's not my dragon. Tom is...
When I was trying to rest, I was lying down there, and the kids would climb all over me, and they still going about like, nothing happened to them. It's really hard to fall sick and trying to take care of the kids as well.
What we've seen over the last month is a significant increase in the number of patients arriving with coronavirus, and what has been really difficult is sometimes how very sick those patients get very quickly. Mask goes straight into the wash bag with my scrubs from work.
Sarah Whitelaw sits on the board of the AMA, which represents medical practitioners across the country. She's also an emergency doctor at a major Melbourne hospital. And as case numbers grow, she's raising the alarm about what lies ahead.
So if the number of cases don't go down, and we're seeing, in fact, just what we're seeing right now, and we continue to move all of our aged care residents directly into the hospital system, within a couple of weeks we will run out of capacity in the Victorian hospital system.
Victoria's Department of Health and Human Services told 7:30 that hospitals have been working to ensure there are enough beds and equipment since January. Thousands of extra nurses have also completed training to treat coronavirus patients. But infectious disease expert Dr. SANJAYA says the system is clearly struggling.
If it was in control and they were happy with where things were going, they wouldn't have gone to stage 4 restrictions and all the various hardships that it can bring. So I believe it was necessary. So if we say on average, 1 case generates about 10 contacts. So in a day like today, we're looking at about 7,000 contacts. It's just too hard.
I came into the hospital system with this broken ankle. Unfortunately, I contracted the virus a couple of weeks ago.
74-year-old Alan Davidson is one of 35 people who contracted the virus in an outbreak linked to Melbourne's Hazeldean Transition Care Medical Unit.
I was in this room with 3 other patients. There'd been a patient who had tested positive. So we were all swabbed on that Saturday. I became rather nervous because we did have a dementia patient who was in the habit of walking up and down the corridor and touching everybody, and I thought, oh gee, if he's got it, we're all going to get it. No, I don't.
Alan says his symptoms came on suddenly. He's since been moved to the COVID ward in Sunshine Hospital.
And suddenly I had this overpowering smell of disinfectant that, and I thought my body was reacting. Well, that was obviously the beginning of the virus really starting to take hold.
I do have stomach discomfort, like reflux, which has never really been a problem for me.
Alan doesn't blame medical staff for what happened, but he does believe there's been a lack of communication with COVID patients like him.
Actually, I've been a little bit disappointed about that. It's almost the only thing they seemed to be interested in was when did I first have a runny nose? They didn't sort of, talk about, people I might have come into contact with.
In a statement, Western Health, which manages Hazeldean Transition Care, said its patients were not permitted to touch one another and workers endeavoured to stop this from happening. As the number of cases continues to grow, so does the strain on medical staff.
We thought at the beginning of this pandemic that our problem was going to be intensive care beds and the number of ventilators. And in fact, we've all been blindsided by the fact that our problem is workforce. I think the number of healthcare worker infections is a real concern. That is our biggest problem going forward in Victoria over the next couple of weeks and needs also an urgent response.
The pandemic is also taking a personal toll on healthcare workers. Dr Whitelaw and her husband are both doctors treating COVID patients, both apprehensive about what the coming weeks will bring.
We finalised our wills on Wednesday. We're very aware of the risks. We really can't risk both of us becoming very sick from coronavirus or potentially dying. There is, we have 2 small children. That concept of getting a phone call and the last hug that you gave your kids being potentially the last hug that you give your kids is really hard.
The system is definitely stressed, but they still have capacity to bring this around. So it certainly is a difficult time, but it's not at a point where the damage is irreversible.